Hi everyone, I'm so excited to be seeing you again today. Thank you for tuning in. In today's video, I'm going to take you the three-step process to my surgery, which is the pre-surgery, the surgery itself, and the post-surgery. I'll take you through the journey of the things that I did in preparation for the surgery, what happened on the day of the surgery, the last one being the post-surgery when I met with my doctors to discuss the treatment plan. Now sit back and relax and let's get started. My doctors called me and they told me that I needed to be admitted for a week in hospital. I don't like being in a hospital. I don't think anybody does. In my case, it was because it was the week when COVID lockdown had just started. So at that time, the doctors needed to be extra careful. I needed to go through other tests just to make sure that before the surgery itself, I am healthy and I'm in a good place. I was admitted on the Monday and my surgery was happening on a Wednesday. So on the Monday, which was the 17th of February, I went into hospital, checked into hospital. What I then did was I had a special book that I had taken with me to the hospital, and I made sure that I took this time as an opportunity to continue reading. So this is the book that I was reading. I was reading Total Forgiveness by R.T. Kendall. This book is amazing. I recommend it to anyone. It's a book that you can read at any point in time. I was going to be going through a surgery. I think there are certain things that I also needed to make sure that I cleared. So this book played a major role on because I was in hospital 2 days before the surgery. On the 18th, it was the preparation day for the surgery where we actually go through the prepping in terms of making sure that I got injected with the radioactive blue dye, which is used to trace the lymph nodes to see if they have any cancer cells in them. Blue dye is injected the night before you have the surgery. So I got injected with that, and I also went in for my ultrasound where my markers on the breast, because the breast will be actually marked with the marker. After I had my markers done, I went back to my room. These are things that I could actually go for and still go back to my room to relax and just continue with my reading. This was a very important time for me as well to reflect. I got prepped for my surgery, and then come Wednesday in the morning, 7 o'clock, the doctors were all surrounding my bed, and you know how serious that time is when you have to sign that consent form of the surgery. The surgery that I had agreed to have was lumpectomy. Lumpectomy is a breast conservative surgery in which they don't remove the entire breast, but they just cut and just take out the tumor. Even though that is what we had agreed with my doctors, should the doctors have found in the theater once they were doing the surgery or conducting the surgery, if they found that my lymphatic system or all my lymph nodes that they were removing were also already infected with cancer cells, that would mean that they won't have much of a choice. They would have to remove the entire breast. When you are doing the consent, these are the issues that we needed to agree upon. We agreed that they were going to take out 3 lymph nodes. There will be a biotechnician who will be waiting there to take the lymph nodes and actually do the testing to see if the lymph nodes are infected with cancer cells or not. That would probably mean that I need more anesthesia so that they continue with the surgery and remove the entire breast and also remove more lymph nodes on my left armpit. I must say I was very calm. I was not shaken at all. I had actually mentally prepared myself when I came in. In that same morning before the surgery, I did all the things that I have been telling you in the previous videos, things like meditation, prayer. I did all that just to make sure that I was at peace and I was in a happy place. At 8:45, the anesthesia introduced himself and I was put to sleep. And then what happened thereafter, I don't remember. What I remember is at 10:45 when I got to the room, I saw my son and my breast physician was there. So I was still a bit sleepy and a bit drowsy, but the minute I was now in full recognition, I broke down. I don't know why I cried so hard, but I do remember crying so badly, and my son was just not understanding why I was crying so much. I guess for me, it was more of the relief that I'm back again in this world and I'm seeing my son, and that really touched me. I was still not thinking straight, so I can't really say why I was crying and why I was going through those emotions at that time, but I guess it's part of the healing process as well. And then a few minutes later, there we were, my son was there, and selfie time, taking selfies. And he was saying, Mommy, I'm so proud of you. And I just felt loved at that moment. And my family was doing a video call. I was seeing everyone. Everyone was happy. After that, my breast surgeon came in. He came to see me. He told me the good news. And the good news was that all my 3 lymph nodes that were taken out were all clear. Also, the breast tissue that was surrounding the tumor that they had also taken, because when they do the surgery, they also take out quite a significant amount of the breast tissue out of your breast so that they can test to see if there are any cancer cells that could have spread in other parts of the breast. And all that came out clear. So my breast surgeon was so happy. He came to deliver the news. I was so happy to hear that as well. Also, that my breast tissue around had come out clear. So those things were the most fundamental things that I wanted to hear. And because we're in hospital, I had to stay until Saturday. When you have a breast cancer surgery, you are inserted with a drainage. And this drainage is to actually help to drain fluids that could accumulate in that place where they would have taken out the tumor, leading to infections of any sort. On Saturday, I was discharged and I was going home. I was so excited to go back home because I felt so fatigued. So going home is something that I was looking forward to, and also because I'd already prepared another diet plan which was going to help me in my healing. I had 2 things that I needed to work on, and it's the kidney and the liver. Not necessarily only those 2, but those are the fundamental organs that help the body to clean out toxins. So as we all know that the liver does the job to neutralize all those anesthetic drugs. Yes, people probably don't realize, but anesthesia is toxic to the body, and hence we get it in such small dosages. For the healing therapy for the liver, I made sure that I was taking milk thistle, turmeric, and holy basil. Those were the 3 herbal medicines that I was actually taking. Holy basil, I have it as an essential oil. Milk thistle is a tea. And turmeric, I have turmeric as a supplementation. That being the case, when I got home, my mom was busy making all these meals, making all these healing dishes that I guided her to say, this is how we're going to do it, and I'm going to be taking this in this dosage and this in that dosage. This was part of the plan, and that's as far as the meals and the diet went. But I also needed to make sure that the physical being is taken care of. I started my exercise. I was already walking the Sunday after being discharged on Saturday. Sunday, I was already taking my walks around the compound. I wasn't too aggressive. I knew that I had just come out of surgery and I needed to slow down. So I was taking my walks in moderation. That's as far as the physical body is concerned. I also needed to make sure that the emotional being is taken care of. So I continued with my normal routine. Then we have the post-surgery part. The post-surgery part is when now we were going back to the hospital to talk with my doctors on the treatment plan. At this point in time, I felt I was already healed and I was in a good place. I was doing a great job in as far as taking care of myself is concerned and making sure that I put my health first. I'm eating well, I'm exercising, I'm emotionally happy, and the environment is full of positivity. There's so much love around me. I was just so overwhelmed with the love that I was getting from family, those who are here and those who are not here, my friends. I was just so pampered left, right, and center. When we met with my doctors, back again to the most crucial subject, which is the treatment plan. I'm sure you've watched my videos and you've noticed that I have not been interested in the conventional treatment. in as far as my therapy is concerned. I wanted more of an integrative approach where, yes, I am using conventional treatments. I'm having surgery. It's a conventional way of getting rid of the tumor. So in combination of science and also the other integrative methods of healing, I still felt my healing journey up to this day, it has to continue that way. So when I went back in, my doctors again, they brought in the proposal. We were back again to square one. Miranda, you're going to be on chemotherapy, 4 times of chemotherapy, once every month. And you're going to have radiation 6 to 7 weeks. And you'll be having it every day of the week, Monday to Friday, except for Saturdays. You'll be having 5 to 10 minute sessions. You're going back to hormonal therapy, exemestane. The drug that I told you gave me life-threatening side effects. So those were the 3 recommendations from the doctors. I won't lie, I told them that I was pretty much disappointed because I thought they understood my philosophy and what I wanted to be my healing process. And I thought we're working together. And they had promised me that they were going to look at other methods of healing as well. And this was before the surgery. I guess the idea was just to coerce me into agreeing, into making sure that we do the surgery and I'm in a good state of mind and I'm not panicking or I'm not emotionally unhappy. So they didn't bring that subject, but they brought it back again. I told my doctors that no, I cannot do that. I cannot have those 3 treatments. I've made it clear from the beginning. I cannot, and I'm not going through that route. And they insisted that I needed to have that kind of treatment because there is a likelihood that it might reoccur. And I said, what is the percentage of reoccurrence in a case like mine? You know, all this is based on probability. It's not set on stone. It's not a fact. You know what I mean? It's just a likelihood. So I say to them, my divine source protects me, and I believe he's going to help me heal from this. And I'm not going to take any of those 3 therapies. And I think maybe let's look closer. Let's zoom in a bit and look at other alternative therapies like the ones that I showed you from Verita Life. And you told me that you had some of them here. And I said, again, we don't need to have a perception. All I want is to make sure that I do things that are going to preserve my body and things that I feel comfortable doing. So let's look at other alternative therapies that can help. And apparently, alternative therapies are way cheaper than conventional therapies because the side effects that come with conventional therapies, and also because you become a prescribed patient, you're prescribed with a monthly drug. Every month you're going to the dispensary, picking up drugs every month. And I said, I cannot do that. I still feel my body has the power to heal itself. And I have a strong willpower. I know that I'm going to overcome this. So I just want you to believe me, to acknowledge my thinking and my mindset as you are also prescribing the medication to me. My surgeon then asked me further and said, okay, what do you have in mind, Miranda? When he asked me that question, I said, how about we do a targeted intraoperative radiotherapy, which is less invasive. It's not for the entire breast, but it's only targeted only for that area. With this kind of therapy, it means that I am trying to protect my lung because radiotherapy kills the lung. After a radiotherapy session, you go and look at someone, they are dehydrated because the lungs are struggling. And some people go into serious toxicity in their bodies and their lungs fail. So I didn't want to risk my life to those levels. So then I said, I think let's look into this therapy because I've seen that other places like Verita Life, they offer this and it's less invasive, it's less toxic to the body. Of course, it's going to kill some of my good cells, but it's going to be killing them in a small area, which is the only area which I had the surgery done. After having presented that to my surgeon, he said, okay, fine, Miranda, we'll go with that therapy. We'll do it 3 weeks instead of the 6 to 7 weeks, which they had wanted me to go on a full-blown radiotherapy. So now I was going to have 3 weeks of targeted intraoperative radiotherapy instead of the conventional full-blown radiation, which you go on for 6 to 7 weeks, and you're going every day of the week, 5 days a week, 5 to 10 minutes every time for each session. Mine was reduced to 3 to 5 minutes. I was going in 5 days a week for 3 weeks. That's what I opted for instead. Knowing that I was also doing that is because I was also being cautious that, yes, there is a likelihood that there might be some cancer cells that might be hiding somewhere, but because my markers came out clear and my lymph nodes were clear. So for me, those 2 indicators were the 2 indicators that I was waiting for to make a decision on my treatment plan after the surgery. So when I went in for that, it was less intense. I never had any side effects. I had my blood routine test done every week, because when you're going for these treatments, every week you have your blood drawn to check your white blood cells, red blood cells, and just to check the general being of your body. My white blood cells were perfect, red blood cells, everything was flourishing, and I was in a good place. So when we finished the conversation about my treatment, my doctors were not happy with what I had opted for, but personally, internally, I was happy and satisfied. I knew that this is the path to my healing. So I want my story to actually be a testimony that there is power in believing in yourself. There is power in also making sure that you address the things that were there from creation. Things like diet. Diet was there since creation. We're meant to eat plants. So I'm on a plant-based diet. Up to this day, I am flourishing. I am happy. Emotionally, I'm in a very good place. I am so thankful for having gone through this journey. I also made sure that I would continue with other therapies. And the other therapies that I've been doing are acupuncture. I go for acupuncture twice after every 2 weeks. I also do things like yoga. It helps my body to relax, and it just helps your mind to focus more. So I have so many other things that I do to make sure that I support my body and I support my spiritual, physical, and emotional. Because those 3 things I feel are the most important things. In my next video, I'm going to be sharing with you another important piece of my healing journey. This important piece is the 2 important tests that I had to do, and these are not done in the normal hospital. These are done by naturopath hospitals. These are other therapies that are helpful to heal the body. So there are 2 tests that I did. One of them is called the Organics Urine Test, followed by a methylation profile. I'll give you more details about what they can help you with in your life. These 2 tests were the 2 dictators that would help me in terms of actually coming up with good strategies that can make sure that I heal from cancer forever and it never reoccurs in my body. Thank you for tuning in. Don't forget to subscribe, like, and share. Love you all. Good night.